Her name was Margaret. She was 78 years old. She paid Medicare every single paycheck from 1967 until the day she retired. 58 years. This is the letter they sent her when the cancer came back. Prior authorization denied. Treatment not medically necessary. 14 days later, Margaret was gone. She wasn't rich. She was a school secretary. Every month they took money from her check so that when she got sick, she would be taken care of. That promise died first. Margaret spent her entire working life believing in a system that was supposed to protect her. She watched the deductions come out of every paycheck, month after month, year after year, decade after decade. She never questioned it. She trusted that when the day came, when she really needed help, it would be there. She did everything right. She paid in full. She followed the rules. She waited her turn. And when her turn came, they looked at her file, looked at her age, looked at the cost, and they said no. Margaret worked at the same elementary school for 34 years. She knew 3 generations of families in her town. She helped children find their lunch money when they lost it. She kept Band-Aids in her desk drawer and crackers for kids who came to school hungry. She remembered every name, every birthday, every family situation. When budget cuts came, she took a pay freeze so the district wouldn't have to lay off a teacher's aide. She volunteered to work summer school for free to help kids who were struggling. That's who she was. That's who they denied. The diagnosis came in early spring. Pancreatic cancer, stage 4. Her doctor didn't sugarcoat it. He told her family the truth. Without immediate treatment, she had weeks, maybe a month. With aggressive intervention, chemotherapy, targeted therapy, possibly a clinical trial, she might have more time. Not years, but months. Time to say goodbye. Time to see her grandchildren one more time. Time to sit in her garden. Time to be a person, not a statistic. Her oncologist submitted the treatment plan the same day. It was standard protocol. It was what any competent physician would recommend. He marked it urgent. He included all the documentation. He did everything by the book. Medicare Advantage, one of the 3 largest private insurers managing Medicare benefits, received the request within 24 hours. They had all the medical records. They had the biopsy results. They had the oncologist's notes, and they denied it. The first denial came back in 48 hours. Reason given was lack of sufficient documentation. Her doctor resubmitted with additional test results, a letter of medical necessity, and a peer-reviewed study showing efficacy of the treatment in similar cases. Second denial. This time, the reason was different. They called it not medically necessary for the patient's condition. Her son called the insurance company. He spent 4 hours on hold over 2 days. When he finally reached someone with authority to review the case, he begged. The audio of that call, distorted to protect identity, is almost unbearable to hear. A grown man pleading for his mother's life, while a customer service representative reads from a script about coverage limitations and appeals processes. They filed the appeal. It was denied again. Third rejection. By this time, 9 days had passed since the diagnosis. Margaret was getting weaker. The pain was increasing. Her doctor prescribed palliative care. He told the family there was nothing more he could do without authorization. He apologized. He said he sees this happen all the time. He said the system is broken. He said he was sorry. Margaret's daughter asked if they could pay out of pocket. The oncologist gave her the number. $87,000 for the first round of treatment alone. Margaret had $12,000 in savings. She had worked her entire life, and that's what she had left. Her son had 3 kids in college. Her daughter was a nurse, barely making her own bills. There was no way to come up with that kind of money, not in the time they had. So they went home, and they waited for her to die. Margaret spent her final days in a hospice bed set up in her living room. She was confused at first. She kept asking when the treatment would start. Her daughter had to explain again and again that the insurance company said no. Margaret didn't understand. She would say, "But I paid. I paid every month. I did everything they asked." Her son stopped trying to explain. There was no explanation that made sense. There was no way to make this okay. Day 1 after the final denial, she could still sit up and talk. Day 2, she needed help getting to the bathroom. Day 3, the pain medication made her sleep most of the day. Day 4, she stopped asking about treatment. Day 5, her grandchildren came to visit. She barely recognized them. Day 6, she couldn't eat. Day 7, she couldn't drink. Day 8, the hospice nurse increased the morphine. Day 9, she drifted in and out of consciousness. Day 10, her breathing changed. Day 11, the family stayed by her side in shifts. Day 12, she opened her eyes one last time and looked at her son. Her last words were, "I paid my whole life for this." Day 13, her breathing became shallow and irregular. Day 14, Margaret died. The funeral was on a Tuesday. 73 people came. Former students, now in their 40s and 50s, drove from 3 states away. They told stories about how she helped them, how she listened, how she cared. The principal read a letter from a student who said Margaret saved his life once by noticing bruises and calling the right people. Her family sat in the front row and nodded and thanked everyone and did not tell them how she really died. They didn't say that she was denied treatment. They didn't explain the prior authorization process. They just said it was cancer, and it was fast. Because how do you tell a room full of people that the system everyone trusts killed someone they loved? This happened in 2024. It's happening right now to someone else while you read these words. And it will keep happening unless people finally see what they're doing. This is not an isolated incident. This is not a bureaucratic mistake. This is the system working exactly as designed. Medicare Advantage plans, despite the name, are private insurance companies. They get paid by the government to manage Medicare benefits. They make more money when they deny care. Every treatment they reject is profit added to their bottom line. Every prior authorization they delay is money saved. Every elderly patient who dies before receiving expensive care is a win for their shareholders. The executives who run these companies make millions in bonuses. Their stock prices go up when denial rates increase. They call it efficiency. They call it fiduciary responsibility. Wall Street calls it a smart investment. Margaret's story is one of thousands, maybe tens of thousands. Nobody knows the real number because nobody is counting. There's no database of people who died waiting for authorization. There's no registry of denied treatments that could have saved lives. There's no accountability. The insurance companies call it cost management. They call it utilization review. They call it evidence-based coverage decisions. But when you strip away the corporate language, it's simpler than that. They took money from a woman for 58 years, and when she needed them most, they let her die. If this happened to your mom, your dad, your husband, your wife, your sister, your brother, someone you love, you need to know you're not alone. These stories need to be told. They need to be heard. They need to be documented. Every single case of denied care that led to suffering or death needs to come into the light. Send these stories forward. Share them. Make them impossible to ignore. Complete anonymity is guaranteed. No names, no faces, no identifying details. Just the truth. Just what happened. Just the timeline from diagnosis to denial to death. This will keep happening until enough people understand what's being done in their name, with their money, to their neighbors, and eventually to them. Right now, while you finish reading this, someone else is being told their prior authorization was denied. Someone else is on hold, waiting to appeal. Someone else is watching their parent, or spouse or child suffer because a corporation decided treatment costs too much. Someone else is hearing that there's nothing more the doctors can do without approval. Someone else is counting down days instead of planning treatment. Subscribe to this information. Pay attention. Share it. Because next time it might be someone you love and you'll wish you had known. This is the reality of Medicare denied. This is what happens when healthcare becomes a profit center. This is Margaret's story. And right now, as you watch this, another Margaret is getting the exact same letter. Subscribe before it's someone you love.